I'm Dr. Travis Peterson. I'm an orthopedic hand surgeon at Tri-City Orthopedic Clinic. I've been with the clinic for the last 5.5 years. One of the most common things that I see is a patient with carpal tunnel syndrome, which is numbness in the hand because of pressure on the median nerve where it travels from the forearm down into the hand. We'll always begin with them giving me a little bit of the history of what's going on with their symptoms. Of course, there's a physical exam that we'll do where we'll test the motor function and sensory function of the hand. We also rely on other diagnostic modalities. In particular, for carpal tunnel syndrome, we most commonly will send patient for an EMG or nerve conduction study, which helps to test the signals of the nerve in the arm to see if there's an area of compression. And so that's our primary diagnostic modality for carpal tunnel syndrome, other than our physical exam and history. In most cases, from the history and after a quick exam, we can get a pretty clear idea of what is likely going on. But the EMG is it's a confirmatory test to help us confirm that diagnosis. Now, we routinely try to utilize conservative treatments prior to considering any surgery. And for carpal tunnel syndrome, that is certainly the case. There are a few things that can be done conservatively. Oftentimes we'll have people wear a splint on their wrist at night. Many times people will have a lot of numbness in their hands while they're sleeping, and it'll awaken them from sleep with this uncomfortable numbness in their hand. And so oftentimes if we can have them wear a splint on their wrist while they're sleeping at night, that helps to hold their wrist in a more neutral position, which tends to minimize the amount of symptoms that they're having at night. In addition to splint wear, we can also try a steroid injection into the carpal tunnel. Once we've utilized splint wear and steroid injections and symptoms persist, we may consider surgical intervention in the form of carpal tunnel release. Carpal tunnel release surgery is the process of trying to take the pressure off the nerve. Carpal tunnel syndrome comes about because there is pressure on the nerve. Nerves don't like to have pressure on them, and they tell us that by giving us numbness and tingling. So if we can go in surgically and take the pressure off the nerve, that oftentimes allows the nerve to recover and symptoms to resolve. When I do carpal tunnel surgery, I can't fix the nerve. I can't make the nerve behave itself and function properly, but I can take the pressure off the nerve, and that's our primary objective when we do carpal tunnel surgery, is to get the pressure off the nerve. Carpal tunnel surgery is an outpatient surgery, in and out the same day. It usually takes us about 15 to 20 minutes to do the surgery. There's always some pre and post-op time, so the stay at the surgery center is a little bit longer, a couple of hours. Recovery from carpal tunnel surgery involves a couple of things. First off, because we've made an incision, we have to put a dressing over the wound and protect it, keep it from getting infected. That dressing is worn for a period of time, and when stitches are ready to come out, we'll go ahead and remove the dressing and get the stitches out. Even during that time, when you have a dressing on, in that immediate post-operative period, people can find that they're quite functional with their hands. I allow them to use them for light activities such as type, write, eat, get dressed, use a computer. Light daily activities and use of the hand is fine, even right after surgery with carpal tunnel syndrome.